No.
Who said that?
Well, my doctor.
Well, why did the doctor say that?
Because he's got just more or less a background on me.
Right, but the doctor doesn't know how WCB operates claims.
Right.
So it doesn't really matter what he thinks.
No.
It's what we can do according to policy.
Okay, now,
And the health minister, the Alberta healthcare system is recession-proof.
It's great to see so many people here. I sure enjoyed the bananas, didn't you?
Well, that's a big relief. But the health minister claims, no, that's just your imagination.
Because in fact, there is no theory behind what I'm telling you. It's all provable. And what I'm saying is provable is that the pharmaceutical industry doesn't want to cure people.
Mr. Speaker, I think the Justice Minister should respond to this.
The workers' compensation insurance companies use the independent medical exam, or the IME, in order to make certain determinations about whether they're going to pay medical benefits, approve medical care, or even pay you actual weekly monetary benefits. The insurance companies use this exam oftentimes to suspend your payments, reduce your payments, or not approve surgery.
Well, that's a big relief.
Over the years, I have found that there are things that are not very independent about these exams. They are not often medical exams, and you're lucky if you even get an exam. What will happen is you will receive a notice to attend an independent medical exam. When you receive this notice, please make sure to record the time, date, and location of this exam. If you miss this exam, it can greatly affect your case.
Happy with that because some people feel that their name's been in too long.
Also, you really need to know where you're going. Believe it or not, many of these medical examiners do not have the exams at their office since they don't even have an office. In fact, I remember one time where I received a phone call from a client who went to an office that was down an alley. When they got there, the people in the office had no idea that there was an exam that was supposed to take place. It turned out later the independent medical examiner didn't even know where he was going and never showed up.
I'm interested in eating my cookie.
So please be sure to pay attention to where you're going. The independent medical examiner is not your friend and is not your doctor.
There's a lot of mistrust of what we're on about. There's nothing I can do about mistrust except to say wait and see.
Many of these doctors are retired or semi-retired, and all they do is independent medical exams. They can be paid hundreds of dollars per exam and do dozens and dozens of exams a week. Just because they're friendly to you doesn't mean that they're your friend.
What's your answer?
Go for it, sir.
What's your answer?
Why don't you answer your question, sir?
What's your answer?
Recently, the New York Times did an article about independent medical exams. It is a very interesting article to actually show you that what the doctor examines, what the doctor says, and what the doctor writes is often very different. They even have a video that an injured worker did of his examination. During that video, you can hear the doctor talking about certain things that were affecting this injured worker. The actual written report, however, showed something very different. Most amazingly, when the doctor was asked about this, he shrugged his shoulders and said, "So what? That's the way it is."
The witness isn't responding.
So once again, please remember, these exams are not very independent. They're being paid for by the insurance company, and you need to protect yourself.
I dislike your comment, sir.
The New York State Workers' Compensation Law allows you to record your examination or bring somebody with you to your exam. I strongly suggest that you do this. Why? Because you never know what the doctor will say, what the doctor will write, or what will happen. You can record this exam with an audio tape recorder or a videotape recorder. Do not be intimidated by the doctor's assistants or by the doctor. The law allows you to do this.
What I'm going to say is this: how well we do in defending our right to health care will depend entirely on our will to fight.
fact, I had one case where the doctor refused to let my client tape record the actual exam. After some phone calls back and forth to the IME scheduling company, the insurance company, and the doctor's office, that IME decided that he himself would also videotape the exam. That was fine by me. It's very simple. If somebody's being recorded, they will likely do what they are supposed to do.
Okay!
You may not believe it, but even if you have a very good exam, what the medical report shows afterwards can be very different.
There's a lot of mistrust of what we're on about.
If for some reason you cannot actually record the examination, please write down some notes about what happened. When you get the medical report, please carefully read it and make any notations about things that were said or not said so that we can provide this proof to the judge. Many of these exams can take less than a couple minutes. You heard me right, less than a couple minutes. I know people who have waited hours for an IME exam. They go into the office, they see the doctor for maybe 2 minutes, 5 minutes if they're lucky, and that is it.
And to ensure that the next generation can also have the same kind of quality of life that we're enjoying in Alberta today.
We've had people who walk into an exam room, the doctor tells them to sit on the table, to get up, to take 2 steps, then the doctor leaves. Miraculously, that doctor then produces a 6-page report.
The witness isn't responding.
There are those IMEs that will actually produce a real exam. They will touch you, tell you to do certain tests, even take measurements. Unfortunately, that doesn't happen that often.
Well, that's a big relief.
After the exam, the insurance company will have 10 days to provide you with a written copy of the actual examination. Please keep a copy of the exam and the envelope that you received. Many times, if it is not sent to you in the proper way at the proper time, we can have the judge throw the exam out, especially if it's not very helpful to you.
No doubt notice that your constituents, the electorate, that's us voters, are onto your pork barrel special interest tax and spend scam.
I have to remind you, the insurance companies use these exams to stop your payments, cut off your treatment, and basically make your life very miserable.
And people were mad, and they let the government know it. The big insurance companies, the big healthcare providing companies, the nursing home companies, and especially the drug companies put relentless pressure on governments right across Canada to do exactly what this government keeps trying to do.
Who can take your money? Who can take your money? With a twinkle in their eye. A twinkle in their eye. Take it all away and give it to some other guy. The government. The government. The government can. The government. The government takes everything we make to pay for all of their solutions. Healthcare, climate change, pollution. Throw away the Constitution. The government takes everything we make. They're power hungry and malicious. Their economics are fictitious. Soon we'll have to eat our dishes. Oh, who can be a failure? In so many ways. And instead of getting fired, hey, we'll give ourselves a raise. The government. Oh, the government can. And the government can, 'cause they make it up. Well, I think it all tastes good.
debate over the Canadian system and whether or not it's working for Canadians. And one voice that we've seen popping up now is that of Dr. Brian Day.
The Canadian health system is a system which focuses on the system rather than the patient. We're calling for a patient-focused system. What we have in Canada is access to a government state-mandated wait list. And the wait lists are long. The patients are languishing and suffering on wait lists.
You're not allowed to bill for medically necessary hospital or physician services.
In Canada, there's a debate over the privatization of services.
In Canada, a number of the clinics are breaking the law by billing patients for medically necessary healthcare services, what we call extra billing.
The Council of Canadians obviously shares the concerns of the other groups at this table about critical issues. And I just want to add that Stephen Harper does not deserve to be re-elected because of his record on trade.
Thank you.